The San Diego Musculoskeletal Project presents Shoulder Exam Part 3, Provocative Tests. This is the third of a three-part series on the shoulder exam. Part 1 covered shoulder anatomy, while Part 2 introduced the first parts of the shoulder physical exam: observation, palpation, range of motion, and strength. Part 3 completes the shoulder exam with the provocative signs. The shoulder provocative signs can be overwhelming with the many eponyms attached to tests. But if we break down the provocative signs by category, then each section has fewer tests to remember and it becomes more manageable. You can perform the provocative tests in any order you like, but it's helpful to have a consistent order so that nothing is left out. If you like mnemonics, you can use the letters BIAS to help you remember the provocative shoulder tests, because the shoulder tests have a bias towards eponyms. B is for biceps tests, I is for impingement tests, A is for acromioclavicular tests, and S is for the stability tests. Now we can start to fill in the categories. We'll just list them now and describe each test in more detail afterwards. The two biceps tests are Yergason's and Speed's. The two impingement tests are Neer's and Hawkins. The acromioclavicular tests are the scarf test and the cross-arm test. And finally, the stability tests include Apprehension, Relocation, Load and Shift, Sulcus Sign, and O'Brien's. Let's start with the B in bias for biceps provocative tests, Yergason's and Speed's. Remember, the biceps has two heads and two major muscular actions, supination and flexion at the elbow. The Yergason and Speed tests simply resist these motions to assess for pain at the biceps tendon. Yergason's test the biceps by resisting supination. First, flex the patient's elbow at 90 degrees. Then test supination by asking the patient to turn their hand palm up while you resist. Place your other hand on the biceps tendon at the bicipital groove. Yergason's test is positive if the resisted biceps actions elicit pain at the biceps tendon or snapping of the tendon in the bicipital groove. Speed's test evaluates resisted biceps flexion. Place the patient's arm palm up straight ahead in forward flexion at 60 degrees. The provider will resist biceps flexion with one hand and place the other hand on the biceps tendon. If the patient feels pain at the biceps tendon during biceps flexion, then Speed's test is positive. After B for biceps comes the I for impingement tests, Neer's and Hawkins. Neer's and Hawkins are both high-yield tests for diagnosis because the subacromial space is often the site of the patient's pain. Remember from our anatomy review that the subacromial space contains the subacromial bursa, supraspinatus tendon, and biceps tendon. Whether the patient's problem is with the contents of the subacromial space or altered architecture of the borders of the subacromial space, the Neer's and Hawkins impingement tests compress the space, which helps you narrow your differential of the patient's shoulder pain. Let's start with Neer's impingement test. Position the patient's arm straight ahead in forward flexion and internal rotation with the thumb down. Raise their arm slowly in forward flexion. If you elicit pain at any point in the forward flexion arc, then Neer's test is positive and you can stop. If they reach full 180 degrees of forward flexion with no pain, then Neer's test is negative. The second impingement test is the Hawkins test. To position the patient, raise the patient's arm to shoulder level at 90 degrees abduction and slightly forward at 30 degrees forward flexion, with the elbow flexed at 90 degrees. Then internally rotate the arm to compress the subacromial space. If pain is elicited, then Hawkins' impingement test is positive. Next, the A in bias stands for the acromioclavicular tests, the scarf and cross-arm tests. Both the cross-arm and scarf tests compress the acromioclavicular joint by moving the humerus medially across the chest. In the scarf test, the patient actively drapes his or her arm around the neck like a scarf. The provider asks if the maneuver elicits pain at the AC joint. If yes, then the test is positive. In the cross-arm test, the patient tries to move his arm across his chest while the provider resists the motion. Again, the provider clarifies whether the maneuver elicits pain at the AC joint. If so, then the test is positive. If the pain is anywhere other than the AC joint, then the test is negative. Finally, the last set of maneuvers in our shoulder exam provocative tests are the stability tests. These 5 tests check for instability of the shoulder joint. As mentioned in the anatomy review, the labrum and capsule are the static stabilizers of the shoulder joint, while the rotator cuff muscles are the dynamic stabilizers of the shoulder joint. If the labrum, capsule, or rotator cuff muscles are torn, the glenohumeral joint may be prone to dislocation. Each test evaluates stability in a slightly different direction. The Apprehension and Relocation tests check for anterior glenohumeral stability, while the Load and Shift test evaluates both anterior and posterior glenohumeral stability. The Sulcus sign can demonstrate inferior shoulder instability. And finally, O'Brien's test may indicate a superior labral tear. The Apprehension and Relocation maneuvers test for anterior glenohumeral instability. These tests are best performed in the supine position when the patient's shoulder muscles are fully relaxed. The Apprehension test consists of placing the patient's arm in throwing position as far back as possible. This throwing position pulls the humeral head forward, which is painful and uncomfortable in patients with anterior instability. The Apprehension test is positive if the patient becomes apprehensive or feels pain. The Relocation test is performed if the patient has a positive apprehension test. The provider relocates the humeral head into the glenoid fossa by applying posterior pressure at the glenohumeral joint. If this posterior glenohumeral pressure alleviates the patient's pain and sense of dislocation, the Relocation test is positive. If the Apprehension test is negative to start with, then the Relocation test does not need to be performed. The Load and Shift test evaluates anterior and posterior glenohumeral instability. Again, this test is best performed with the patient supine with relaxed shoulder muscles. First, provide an axial load to the glenohumeral joint by pushing the humeral head towards the glenoid fossa. Next, gently maneuver the humeral head anteriorly and posteriorly. Increased laxity or pain compared to the other side is a positive test. The Sulcus sign is a simple test for inferior glenohumeral instability. Position the patient with their arm hanging comfortably from their side. The provider simply provides downward traction to the patient's humerus. A sulcus or indentation can be seen between the acromion and the superior humerus because of the negative pressure in the shoulder joint. A sulcus of greater than 1 centimeter or asymmetry compared to the patient's other side may indicate inferior instability. Next, O'Brien's is a test of labral integrity. Position the patient's arm at shoulder level at 90 degrees flexion. Adduct the arm about 45 degrees across the midline with the thumb pointing downwards. Then resist the patient's efforts to raise their arm upwards and evaluate for pain. Repeat the maneuver with the patient's thumb pointing up and again evaluate for pain. If more pain is elicited in the thumb down position than in the thumb up position, O'Brien's test is positive and suspicious for a labral tear. We have now completed the shoulder provocative tests. You may want to review the categories of the tests a few times until you can recall them easily. If you use bias as a mnemonic, remember that B is for biceps, I is for impingement, A is for acromioclavicular, and S is for the stability tests. You can then add in the specific tests of each category. For the bicep tests, Yergason's and Speed's. For the impingement tests, Neer's and Hawkins. For the acromioclavicular tests, the scarf and cross-arm tests. And finally, for the stability tests, Apprehension and Relocation, Load and Shift, O'Brien's, and the Sulcus Sign. Keep in mind that there are even more shoulder exam tests with even more eponyms, and you can fold these in if you find them useful in the future. But the tests listed here are a good start to the basic shoulder exam. Creating a shoulder exam template can be one advantage of the electronic medical record, and it can help you remember the details of the exam if you do not perform it often. This is an example of a shoulder exam write-up, which we usually give to our medical students. This concludes our 3-part shoulder exam video series. I hope you found the information helpful. This video was brought to you by the San Diego Musculoskeletal Project. Thank you for watching.